We are here today to discuss about the various reasons why a child generally tends to put non-nutritive things such as mud or paint into his or her mouth. Hi, I am Dr. Alan Pereira, a pediatrician and allergist at Children's Hospital Mumbai at Malad. So the act of eating non-nutritive things is called pica and is a very common phenomenon seen in almost 10 to 30% of children up to the age of 8 years. So this is the way the toddler explores the world around him, because the toddler has no idea of what is edible and what is not edible, what he's supposed to eat and what he's not supposed to eat. As the child grows up, this phenomenon tends to have a decline and it goes off by the time the child is 3 to 4 years of age usually. The reasons for it to persist can vary among different children. Sometimes it can be a stressful situation either at home, in school or in daycare, due to which the child starts eating these non-nutritive things such as mud or pica. At other times it can be the socio-economical situation where the child is not getting enough of nutrition at home. Especially deficiencies such as iron deficiencies can cause a child to start consuming things such as mud or paint from the walls. Rarely in cases of toddlers, it is because of a positive feedback. Soon as the child starts putting things into his mouth, maybe the paint from the wall, a chip of paint, or maybe mud, the parents find it amusing, they laugh or they give him more attention. So a toddler learns that by doing this, I can get some attention from my parents who may not be giving him that much of attention. Anemia is quite common in our country and one of the most common causes of pica. So when we see a child who has pica and who's anemic, giving iron supplements does tend to reduce or decrease the pica. Similarly, we have to take into consideration the family environment, the school environment, the daycare, tuitions. Whether it is a stressful situation, is the child being shouted at quite often, or is the child under some kind of stress which the parents have not been able to perceive, but the child is reacting to by having pica. So what happens with pica? Because the child is eating non-nutritive things, it doesn't give him any kind of nutrition. Eating mud can lead to other infections such as helminth infection, that is worm infections. Paint consumption or pencil lead consumption can also lead to lead toxicity in a child. So we are not only looking at the nutrition part of it, but also there's a possibility of various infections as well as toxicities that come in with the habit of pica.